we termed the acronym STAFE. It stands for Sexual Assault Forensic Nurse. We have since broadened our title to the Forensic Examiner program because we now see patients who are impacted not only by sexual assault, but by domestic violence, pediatric physical abuse, and elder abuse. If it is a male who has victimized a female, that there were 52 other victims before they were caught. If it is a male perpetrator with a male victim, they find that there are over 100 kids that were perpetrated before that person was caught. So for every person that we intervene with, not only are we serving their individual needs and getting them on a road to recovery, but we're also protecting those 51 or those 99 other kids in our community from becoming victims. What we want to do is avoid the long-term consequences. So what research has been able to show us at this point is something bad happens to an individual, it has the potential to lead to poor choices. For example, you may have patients who develop depression, post-traumatic stress, lead to cutting behaviors, lead to inpatient utilization of mental health services. You could have an individual who is impacted and becomes sexually promiscuous, leading to unwanted pregnancies, leading to sexually transmitted diseases, long-term infertility because of those complications.
This is very important for a hospital to have this service. This population requires specialized attention when they come in. We're not only addressing the physical injuries that the person may have incurred, but we're also looking at the psychosocial aspect of the crime and how it has impacted them. When the SAFE nurses go through education here at York Hospital, they're not only getting the aspect of the crime itself and how it impacts that person, but we're also teaching them how to collect evidence that may potentially be on that person from the crime that incurred. We are also teaching them to document any injuries that they may have incurred from the assaults, so they're taking photographs of those injuries and documenting that. Based on the training that they got, they have expertise in this field to be able to then testify in court to the findings that they have from the examination.
Part of the funds that we're hoping to receive through the Employee Giving Campaign is going to support additional nurses becoming certified that are currently on the team. It's also going to help with continuing education for the nurses who are currently on the team. And we're looking at the potential of being able to train new nurses to join our team.
The Adams County Cancer Patient Help Fund was created to ease the financial burden of patients and their family while they're undergoing cancer treatments. The Adams County Cancer Patient Help Fund helps approximately 80 families every year, which ends up being a little over $200,000 a year. The fund also pays for things like utilities, rent or mortgage. We help with the everyday costs that a person undergoing cancer treatments would need assistance with. When most people are undergoing treatment for any type of cancer, they experience either a loss of job or a loss of hours at work, which equates to a loss of income. It can also mean a loss of health insurance, so they may be paying extra to maintain what health insurance they have to maintain their health. And that's where the Adams Cancer Patient Help Fund can step in so that we can help them alleviate that financial stress by paying some of those daily basic needs. There are no administrative costs for the Help Fund, and all of the funds stay here locally in Adams County. The fund does not have a main fundraiser event, and it relies solely on donations made by various groups in the community. Individuals, families, groups like Girl Scouts, Boy Scouts, churches, all of these groups have donated to this Help Fund in the past, and we really rely on individual and group donations to keep this fund going. The Adams County Mammography Fund supports women so that they are able to get their yearly screening mammogram at no cost to them if they are underinsured or uninsured. It also follows up with diagnostic testing if the need arises. In 2012, approximately 60 women used the Help Fund to receive their screening mammogram, and every year that number goes up. The Mammography Help Fund has partnered with the Gettysburg Hospital so that we can provide a woman with a mammogram for just $77. If a WellSpan employee contributes $3 a paycheck, they will help a woman receive her screening mammogram once a year.
Be a part of something great.
Be part of something great.
Be a part of something great.